Thank you, Amber, and hello, everybody in Georgia's 5th Congressional District. Thank you so much for joining us this evening. Y'all, I am Congresswoman Nikema Williams, and it is my honor to represent you in the United States Congress. For anyone who just hopped on the line tonight, tonight's telephone town hall is all about health care and important updates to the Medicaid program that could have a big impact on your coverage. Y'all, I believe that health care is a basic human right. I know from personal experience that our ability to access care can change and often save our lives. There was once a time, not so long ago, that I didn't have health insurance. I got into a car accident riding down I-20, and my car was totaled, and I was left there trying to decide what to do as my car was carried off and the ambulance was on the side of the road. But I knew that I didn't know how I would be able to pay that bill if I took that ambulance ride to get checked out. And everyone has heard the advice that you should go to the ER no matter what after a car accident just to make sure that everything is okay. But without health insurance, I had a fear that that emergency room visit would be so expensive that it would make me have to choose between paying other bills. So I chose not to receive medical care that day, and that's a choice that no person should ever have to make. Every person should have the ability to visit a doctor when they need medical care, regardless of the size of their bank account or their zip code. In Congress, I've co-sponsored Medicare for All legislation, and I'm committed to the promise of universal quality health care coverage. But y'all, we still have work to do to get there. And before we get to our guest speaker, I need to make sure that you know that I am here to answer your questions. I want to remind y'all all about an important step that we took and passed into law last year. When we passed the Inflation Reduction Act, which is just a fancy way of saying lowering costs and putting more money in your family's pockets, we set a $35 cap on monthly insulin costs. Y'all, I lost my grandmother to complications from uncontrolled diabetes. Our ability to access the care that we need can change and often save lives. So while I'll keep working in Congress towards universal coverage, it is my responsibility and obligation to make sure that you know about all of the resources available to you right now. And to help us out, we have a special guest this evening, and I'd like to introduce you to my friend, Mr. Antrell Tyson, who is no stranger to the fighting 5th Congressional District. Y'all, he's the Region 4 Director for the Department of Health and Human Services. Director Tyson is going to tell us about the upcoming changes to Medicaid and what to look out for so that you can continue getting the care that you need. After Director Tyson speaks, we'll get to your questions because tonight is all about you and answering your questions. Remember, when it's time, dial 0 to be connected with someone who will take down your questions. Director Tyson, the line is all yours.
Thank you, Congresswoman, and good evening, everyone. Congresswoman, I'd like to thank you for inviting me to speak to your constituents, but also I'd like to thank you for being a fearless leader as a proud resident and constituent of the Georgia 5th Congressional District. But I'm here to talk about all the things that are changing in Medicaid because I am sure that many of you probably have not heard, but as of April 1st, states are now allowed to start going back to redetermine eligibility for Medicaid recipients in what we are referring to as Medicaid unwinding or Medicaid redetermination. To better explain what Medicaid unwinding or the redetermination is, let me back up a minute and explain how we got here. Over the past 3 years, we've been under a public health emergency due to the COVID-19 pandemic. And because of the public health emergency, the federal government asked states not to remove anyone from their Medicare rolls because there were two things that we did not want to happen. One, we didn't want people to expose themselves to COVID-19 by going into the office for their annual renewals, nor did we want hundreds of thousands of people to get kicked off of Medicaid during the pandemic because they decided to stay home and not go into the office for the renewals. As a result, over the last 3 years, we have seen Medicaid enrollments increase by nearly 677,000 people in the state of Georgia. This is a good thing. This means that more people have health care now in the state than ever before. But now that the public health emergency is coming to an end, as of April 1st, states are now allowed to start back redetermining whether current enrollees are eligible for Medicaid or not. So that means that over the next year, the state will have to reevaluate all 2.7 million people currently on Medicaid to redetermine their Medicaid eligibility. We do anticipate that there will be a number of people who lose Medicaid because they've gotten a better job or their financial situation has improved. But our challenge is to make sure that those who are eligible and who rely on Medicaid don't lose coverage due to administrative reasons. That is why we're asking everyone on Medicaid or whose children are on CHIP or PEACH care, or even those of you who may know someone on Medicaid or CHIP, to make sure their contact information is up to date in the Georgia Gateway portal so that the states can contact them about their coverage. Also, we ask that you check their mail regularly because that will be the state's primary form of communication unless you opt into receiving emails. And if you receive any forms from the state regarding your Medicaid coverage, please complete it and send it back as soon as possible. And for those of you who are determined to no longer be eligible for Medicaid, there are a plethora of resources on our website at www.healthcare.gov that can help you apply for affordable health care coverage through the healthcare marketplace. Please know that the Department of Health and Human Services is working to facilitate continual coverage for everyone currently on Medicaid, whether you remain on Medicaid or if you need to transition into the marketplace. Please use our office as a resource. So, if you would like to know more information about the unwinding process, you can visit us online at www.medicaid.gov/renewals, or you can follow us on Twitter at HHS Region 4, and 4 is IV. It's the Roman numeral, not the number, so that's HHS Region IV, or you can simply reach out to the Congresswoman's office and they can put you in contact with our office. I really appreciate this opportunity to collaborate with you, Congresswoman Williams, to help ensure that each of your constituents have the information they need to stay covered. I look forward to answering any of your questions and helping you navigate this incredibly important process. Thank you.
Thank you, Director Tyson. And you're exactly right. They can reach out to our office and we'll tell them where to find you because I know that you have a lot of answers to all of the questions and we're going to get to some of those audience questions tonight. And while we pull up those questions and get people connected on the line, can you tell us why it's so important for people to understand the current changes taking place with Medicaid?
That is a great question. So while the unwinding process will take place over the next year, the window of opportunity for Medicaid enrollees to keep their coverage is much more narrow. So, for example, if someone is moved during after 2020 and the Medicaid office needs to get updated, let's say, income verification information, but now they don't know how to reach you, that recipient has 30 days to respond to the notice from the state before they're terminated. So if you have missing information in the Gateway portal and the state is trying to reach out to you, you have 30 days to respond or you will be kicked off the Medicaid rolls. So as you can imagine, what we're trying to avoid are people that have made some type of move during the last 3 years and they have not been in contact with the Medicaid office, and then they don't find out until they go to the doctor that they've been terminated and they don't have any health care. So, we want to get more people covered. We are trying to avoid the loss of hundreds of thousands of people on these Medicaid rolls.
Thank you for that explanation, Director Tyson. And now we're going to get to some of these more specific questions. And I think Amber is pulling some of that together.
Yes. One moment. I am pulling up our first question here.
We have lots of questions, so I hope you're ready, Director Tyson.
Bring them
on.
All
right.
I'm ready.
One moment. All right. Looking for an Ira Major in Atlanta, Georgia. Ira, are you there?
Yes, I'm here.
Go ahead. The floor is yours.
Can you hear me?
Yes, we can hear you.
Yes, great. Thank you for the time. Yes, I recently got qualified for Medicare April 1st and through Social Security. And I was wondering, I had a flood of calls regarding outside vendors as far as getting outside vendors for like United Healthcare for to take over my Medicare benefits. Is that mandatory? Hopefully I explained myself correct.
So I think you're referring to a managed care program. What I would refer you to do, if you can reach out to my office, please reach out to the Congresswoman. I want to know more about your situation. But there are resources available through the state health insurance program that can help you navigate that and make sure that you're being directed to an actual managed care program and not some secondary or third outside resource that is trying to get to your money. So if you can please reach out to the Congresswoman's office and they can get you in contact with our office, we will make sure we connect you with resources within CMS to get you connected to the right people.
Mr. Major, this is Congresswoman Williams. I'm going to give you our office phone number so that you can call us, and we want to make sure that you get all of the information that you need for your specific situation. That office number is 404-659-0116.
Thank you, Congresswoman. Next, we're going to go to David in Avondale Estates. David, are you on the line?
Yes. My question is, are you there?
Yes, we're here.
My question is insulin the same price for Medicare as it is for Medicaid?
So, I don't know. Thanks to Congresswoman Williams and our congressional colleagues, we were able to lower the cost of insulin for Medicare Part D patients to $35. But the great thing about that is because our congressional colleagues took a bold stance and allowed for the Biden administration to negotiate prices, we have started to see private pharmaceutical companies lower their costs across the board. And companies like Eli Lilly will now charge only $35 for all their insulin. So that is for not only Medicaid recipients, but those are for people that have private insurance as well. So although the Inflation Reduction Act only applied to Medicare recipients, we're starting to see the market follow that trend, and everybody starting to bring down the cost for insulin, whether you're through the private marketplace and even in Medicaid.
All right, thank you for that. The next question we're going to go to Ms. Nicole Taylor. Nicole, welcome to Atlanta, by the way. Go ahead and ask your question. It says we're still servicing your request. Okay. We had a little bit of a technical difficulty there, but Ms. Taylor wanted to know, just recently moved to Atlanta and wanted to know how to apply for Medicaid. Can anyone, Regional Director Tyson, can you give Ms. Taylor some pointers on how to apply for Medicaid?
absolutely, she can go to gateway.ga.gov/access, and she can click on the Apply for Benefits button, and she will be connected to someone at the state to help walk her through the Medicaid application process. So again, that is gateway.ga.gov/access.
Got it. Thank you. Next caller on the line, I believe it's Renee. Ms. Edwards wanted to know about.
Yes.
Yes. Go ahead. Ask your question, please.
No, I thought you had already took it, but you still want me to go ahead and say it. Okay, I'll go ahead and say it. My name is Renee Edwards, and I was my concern was about seniors and children, parents that do not know that have children that have asthma, or seniors that have different medical problems. How would they know that their Medicaid, they're going to be kicked out of the system if they usually been doing an update, automatically putting them in the system? But now, I guess that's this new bill or new whatever order, he said as of April the 1st, if the kids, parents, or the seniors have not sent in an update form, which I did see it come in the mail for my daughter, but my daughter is thinking that they're going to automatically keep still updating the system with her to keep my daughter on, my grandbaby on Medicaid because she has the asthma. So what about the people that don't know that? And then I had like a part two question was, what about the faith-based churches that we have seniors in these churches, but they do not know this information at all? How is it that you all are going to get this information out to them?
Thank you, Renee, for your. That is perfect. I love both of those questions. So the first question to your daughter's situation, that is why we want to have this conversation, because the state will not automatically renew. Now, they will if all of your information stays the same, but do not rely on that. If they send something in the mail, you want to respond to what they send you in the mail. So tell your daughter, let's read and ask and see if they're asking for additional information, because this is different. This is not like they're not doing redeterminations like they have for the last 3 years. They want to go through and make sure that everybody's income still qualified, to see if anybody's changed their employment, changed their address. So there may still be missing information that the state is going to require to continue her eligibility. So make sure that if that letter says anything other than your health care has been renewed, please respond to the letter and respond directly to the state of Georgia's Medicaid office, which the Department of Children and Family Services, DFACS, they are running the entire redetermination process. So make sure that she calls. And I would even say give them a call just to make sure that everything is okay. Even if it says you have been renewed, still call them anyway and just say, I got this letter in the mail. I want to make sure that my coverage has been renewed up until whatever date it says it has been renewed. That is exactly what we want people to do, is encourage folks to call the state office to ensure that their coverage is not going to lapse or be terminated. To the second question, we are absolutely planning to reach out to the faith-based community. And if there are any opportunities for me or one of my colleagues to come speak at any of your churches or faith-based communities, we are open to that opportunity. But if anyone wants to get involved in this Medicaid unwinding process, we are asking for community support. And if you wanted to get more information, please feel free to go to www.medicaid.gov/unwinding. Now, I know earlier I said renewal, and renewal is to for you personally or for Medicaid recipients to find out their status and find out more information about the process. But for anyone in the community that wants to help get the word out, go to www.medicaid.gov/unwinding to figure out how you can get involved. We have a whole unwinding toolkit. We have tweets. We have social media posts. We have just letters. There's a plethora of information that you can use to help get the information out. So you can go there yourself. You can direct any leader, church leader, to that information. Or, again, you can reach out to the Congresswoman's office, and you can reach out to me, and you can put in a request for me to come speak at your church. All of that is fair game because we want to make sure that everybody knows. Check your mail and call the Medicaid office to make sure nothing is happening with your coverage.
Thank you for that. And thank you all on the line for all of your questions. Let's see if there are any more Medicaid questions. Actually, there's one more here that we want to get to. Mr. Barnes from Atlanta, Georgia. Mr. Barnes, if you're on the line. Yes.
My question is about, are they just dropping partial Medicaid? Because I thought I had it, and I think I was told that I don't have Medicaid anymore. But I'm pretty sure I had partial Medicaid.
Okay, so again, I would want to learn more about your information so you can reach out to our office directly. But everyone that is on any Medicaid roll will have to go through redetermination. So if you are on Medicaid, the Medicaid roll as of April 1st, you would also have to go through redetermination. But
but can I go into the office and reapply rather than doing it over the internet or online?
Yes, you can. There will be, from what I know, that there's going to be limited time windows that the state is going to be open for walk-ins. So I will call to clarify which days they will be open for in-person.
Okay.
But I do know that they will have limited time where they will have in-person enrollment.
Well, when I get there, then they should be able to let me know whether I need to re-up for it or not.
Yes, ma'am, they should. Now, do you have access to your gateway portal?
Oh, Director Tyson, we wanted to make sure that we get her question answered.
Yes.
So what is that contact information one more time?
So the gateway portal is gateway.ga.gov/access. And if you want to, the HHS website will be www.medicaid.gov/renewals.
All right. Let's see. Oh, we've got another Medicaid question here. One more. Brenda Caulfield. It looks like Brenda Caulfield from Atlanta. Are you on the line?
Yes, ma'am, I am.
Go right ahead.
Okay, my first question was, when you go to DFAX to apply for Medicare, some will help you, but they tell you you don't have to apply, or I'm just so confused. And my second question is, I have WellCare. I don't know how it's going to affect Medicaid per se. And also you stated to us to look out in the mail. We almost at the end of April, and I had not received anything at this point, so I'm just really confused. And I have one more question. A couple of years ago, someone told me that this was going to come into effect, and by them opening up in East Point the budget, in which would be handled by Morehouse School of Medicine. And they also said that the conversation that we're having right now about the Medicaid. is going to be demolished. So I am really confused at this point.
Got it. Okay, so that was a lot, but let me take them in pieces. So, WellCare is Georgia's Medicare plan. That is not the Medicaid plan. So those are different. So Medicare is not impacted by this unwinding. All of Medicare is ran by the federal government. So we are not going to require anybody to reapply outside of the regular means. That's separate. But Medicaid, so with this during unwinding for the next year, everybody's not going to get a notice on the first day. So if you haven't received a notice, if you're on Medicaid and you haven't received a notice as of today, your letter will be coming in the mail at some point over the next year, which is why we're asking people to continue to check the mail, because even if you're not front of the line, you may be in the middle of the line. If you're not in the middle of the line, you may be at the end of the line, which means that you'll be checking the mail and not receiving anything until maybe a year from now. So they have not made any indication of who they're prioritizing, or at least they have not made that public. So all we can ask for people to do is to continue to check the mail to make sure that they have some communication from the Medicaid office saying, one, your health care has been renewed, or two, we need more information from you, or third, they say that you no longer qualify. Here's information to go apply for health care in the marketplace. It's really complicated, and I get it, but you haven't received anything in the mail yet. You will eventually at some point through the next year. And I missed the first question was that when you go to the Medicaid office, they don't help you with Medicare. Reach out to the Congresswoman's office, and we will get you connected to someone with CMS or someone at the state health insurance program to help you navigate and get connected to Medicare services through the federal government.
Thank you. And I know I said we were going to move on, but one very important question that has come up from 3 people, so I'm going to go ahead and ask. People are asking about SSI and Medicaid changes. If people who receive SSI, will they still need to recertify? Will SSI affect their Medicaid? Is there anything that you can point folks on the line who may be receiving SSI to as it comes to this unwinding?
Great question. So your SSI does not need to be renewed, only the Medicaid. And your SSI income does not impact your ability to qualify for Medicaid. So hopefully those are 2 different questions that I answered. So your SSI does not need to be renewed, nor do the SSI payments count toward Medicaid.
That actually segues, as you did answer 2 questions in one, into another question. We have a few questions about income requirements for Medicaid. Is there a place online or somewhere where we can send people to if they have questions about the income requirements if they want to get Medicaid?
Yes, so that is, you can go on the Georgia State website, so that's the Department of Community Health. And if I'm not mistaken, the Georgia income requirement is 31% of the national poverty limit. So it's very low. But you can find that information on the state's website.
Thank you. Okay, one more. This is an important issue, y'all. So the lines are hot. It looks like Miss Cora Cooper on the line.
Yes, this is Cora Cooper.
Go ahead and ask your question, please, ma'am.
Okay, my son has a disability, a mental disability, and a physical disability, the combination. And he receives Medicaid and Medicare. If they should just cut him off of the Medicaid part of it, what would be my next step? What would be my next option?
Okay, great question. So, we wouldn't want for him to get cut off Medicaid at all. So if you have not received any information from the state Medicaid office at this time, you're still ahead of the game, and I would suggest that you continue or recommend that you continue to check your email or your mail to make sure that you receive that form in the mail, because if he is physically disabled, he should continue to qualify for Medicaid. So we wouldn't want for him to fall off the Medicaid roll at all. Now, if he does, then you will have to go through the whole reapplication process, reapply for Medicaid. But the goal and the purpose is for him to not fall off the Medicaid roll if he continues to qualify.
Thank you for that. And everyone on the line, thank you for all of your questions. We'll take a few more questions that are specifically for some of the Congresswoman's constituent service work a little bit later. But right now, I want to toss it back over to the Congresswoman.
Thank you, Amber, and thank you so much, Director Tyson, for answering all of those questions. And as you heard from Director Tyson, remember, if you receive a redetermination letter, you have 30 days to respond. So y'all don't wait. If you're anything like me, you got that stack of mail sitting on the corner of the table, and you say you're going to get back to it, and sometimes it's more than 30 days before you get to it. But you can't do that with this notice, y'all. If you receive that redetermination letter, you have 30 days, so make sure that you respond. So now we're going to switch gears just a little bit, because another big part of my job is helping you when you need assistance with federal agencies. Whether it's the Center for Medicare Services, the IRS, Social Security, or any other federal agency, our office can help you solve the problem, get you the information you need, get you to the right person, and sometimes that means putting more money in your pocket and getting you the benefits that you're owed from the federal government. Last year alone, we were able to return over $10 million directly into the pockets of constituents in the Fighting 5th District. Y'all, teamwork makes the dream work, and I'm thrilled to have an incredible constituent services team working on your behalf every day. Since we get calls daily about how we can help, I want to introduce you to Jarrett McKinley, my district director, to give you a quick overview. Jarrett, it's your turn.
Thank you, Congresswoman, and thank you, Director Tyson. The information that you both are giving is absolutely invaluable. Okay, so from a constituent service perspective, the Congresswoman has us in place to make sure that we can help you with your federal issues, and we do that out loud and on purpose. That's the Congresswoman's term. We love it and we live by it. So to reach our office, you would call the same number that the Congresswoman gave earlier, 404-659-0116. That phone number again, 404-659-0116. The team that the Congresswoman has put in place is here to help you with your federal issues. The Congresswoman mentioned some of them: IRS, Medicare, of course, this Medicaid issue, and we hope that it's not going to be one, but we are here. We do IRS, as I've mentioned, USCIS, immigration. We are here. Our hours of operation, 9 to 6, Monday through Friday. We will return your call. If you have issues reaching us, I'm going to give you one other number, which is my direct cell, which is 404-623-7414. That number again, 404-623-7414. If you call our office in regards to this Medicare concern, we will again get you the information to get you to the right place so that you can be serviced. The Congresswoman believes in health care. She believes in making sure that our families are taken care of, and she believes that that is her job, and we support her 100% in that effort. We look forward to hearing from you. If you need us, we are here, 404-659-0116. Jared McKinley, District Director for Congresswoman Nikema Williams. Thank you so very much for being on this call.
Thank you, Jared. Jared, want to open up the line for a few quick constituent services questions. And remember, for those on the line, if you'd like to ask a question, please dial 0, and you will be connected to someone who will take your question down. Jared, you up for some questions?
I am here for you.
Wonderful. We've got Quentin Fielder. Quentin Fielder, sir, are you on the line?
Yes, ma'am. Yes, ma'am.
Go ahead and ask your question.
Yes, ma'am. Okay, I had asked my question. You all got me in line.
Yes, you wanted to know.
2 months ago, so
I can help you out there, sir.
I just needed to make sure that our checks weren't going to get cut off in the area of our checks is something that we need to continue to run rapidly. It's not something that needs to be cut off at any time.
Got it, sir. Jared, if someone is having a problem getting the benefits that they need, give us one more time. Let us know what the number to call is and what benefit areas that y'all specifically can do constituent service work with.
Not a problem at all. That phone number, 404-659-0116, 404-659-0116. Now, the interesting thing is that we pride ourselves on being able to connect constituents with the proper agency, and as the gentleman was saying, in order to make sure that the dollars that you deserve, that you are owed, comes back to your household. So depending on what area of the federal government, if it's IRS, if it's your Social Security benefits, we are here. You just have to contact our office. One of my team members will then talk to you about your situation and direct you in the right place. If it's not a federal issue, but if it is, we will take hold and run with it and be guaranteed that we will assist in any way that we can. Thank you, Amber.
And Mr. Fielder, this is Congresswoman Williams, and just to follow up on that, I know that we want our hard-earned money to show up when it's supposed to, and when it comes to Social Security, I want you to know that in the House Democratic Caucus, we approved the largest increase in Social Security benefits in over 30 years. So if you have not seen that increase as of yet, you should be seeing it any month now. So looking forward to everyone getting more money in their pockets. We know that the cost of living is rising, groceries are going up, and everybody could use a little bit more money in their pockets.
All right, then. Thank you for that, Congresswoman. We're going to go to one more question. We've got Miss Marianne Artberry.
Yes. Hello?
Yes, you're here. What's your question, ma'am?
When I was getting out there back pay money for disabled people, and I not received my money. I don't know where my money went to. They was getting out of gift cards for disabled people, the $350 gift or whatever it was, but I not received mine. But this is mailed in October. I didn't see it.
All right. I'm sorry. Is this Ms. Marion?
Yes.
Okay, please do me a favor. Call our office
Yes.
so I can find out what agency, and I think I have an idea, but we can make sure that you get directed to the right place. And you can just ask for Jared. My phone number, 404.
Hold on. Slow down. Slow down. I got arthritis in my hand, baby. Slow down.
Take your time.
Okay, what is it now?
Okay, 404.
Okay, you said 404.
Yes, ma'am. 659.
659.
0 1
116. Okay, you said 0116. Okay.
Yes, ma'am. 404-659-0116.
Okay, 0. I got you.
All righty. And if you call tomorrow, we'll have somebody speak with you and make sure you get led in the right direction.
Thank you, Jared.
Absolutely.
Thank you, Jared. We are looking at the time. We are running to the end, but I see a few more questions in here. Want to remind everybody that when you hop off the line, there is the opportunity when we close this out for you to leave your question as a message. We review those and we make sure that we get back to people. But I want to make sure that we're respectful of our guest time and everyone who's sitting on the phone with us on this busy Monday evening. So, Jared, thank you. And I want to toss it back over to the Congresswoman.
Thank you, Amber. And thank you, Jared. Thank you, Director Tyson. Y'all, thank you so much to all of the constituents who joined in with us tonight. We had nearly 7,000 people in Georgia's 5th Congressional District tuning in tonight because you understand the importance of this information, and I hope that you will help us by sharing this information with someone who couldn't join us tonight. Remember, I am here to serve you. So if you need any assistance with the federal agency or anything else that we can be helpful with, give our office a call at 404-659-0116. If you have questions or concerns about legislation, you can call my Washington, D.C. office at 202-225-3801. If we didn't get to your question tonight, be sure to listen in closely before you disconnect, and you'll have the opportunity to leave us a message and we can get information back to you. Again, thank you for joining us and have a great evening.